Joining us now, Democratic Congresswoman Pramila Jayapal of Washington State. Congresswoman, it's great to have you on the show. Thank you so much for making time. Obviously, Donald Trump is not saying the truth there. It's, a flat-out lie. I know he's saying that Democrats are not on board with doing something about Dreamers. You, along with your colleague, Congresswoman Sylvia Garcia of Texas, reintroduced the Bipartisan American Dream and Promise Act in February, which would provide a pathway of citizenship to Dreamers. So does he not know about it, or is he lying about it?
He is lying about it. Amen. I mean, look, we've introduced the DREAM Act, and it's been bipartisan every session since I've been in Congress. So that's at least 4. And I know it goes back before then. And the reality is that he and Republicans have refused to move any of these things forward. The DREAM Act, the Bipartisan Farm Worker Modernization Act. We had a comprehensive immigration reform bill. We even had Democrats even introduced a bipartisan Senate bill that was just about the border, which is what he claims to care about. Many of us didn't like the bill because it didn't have other things in it, but he wouldn't even move that forward. So let's be clear that everything that you've been discussing in this last segment is what he's really about. He wants to completely shut down immigration to this country. He's lying to people about what he said during the campaign, which is, I'm going to go after the worst of the worst, the criminals. The people that he's picking up right now are people who have legal status, U.S. citizens, including U.S. citizen children with cancer, legal permanent residents. This is not at all what he promised. And that's, I think, part of the reason you see the polling numbers have dropped so substantially on immigration and what he's doing.
Congresswoman, on the 100th day of Trump's presidency, you and Senator Sanders introduced Medicaid for all. What are you hoping to do with this legislation? Does it have any hope, or is this a symbolic move to get the conversation going again?
Well, we introduced Medicare for all, and basically what we've been saying is there are 100 million Americans who are uninsured or underinsured in the richest country in the world. There are literally people, 1 in 3 Americans has medical debt totaling a total of $220 billion of medical debt. And so what we know is that Americans across the country want affordable quality health care. And the United States is the only country, industrialized country in the world that does not provide it. In fact, the United States, we spend more on health care per capita and have worse outcomes than other countries. So Medicare for all is just saying your government insurance could be covered by Medicare, an expanded, improved Medicare, and everybody would have health care, no premium, private insurance premiums, no deductibles, no copays, and you would actually have health care from the day you were born to the day you die. It is incredibly popular. 70% of people across America support it, and I think we need to continue to push it out because it is a travesty. It's criminal in my mind that so many people are dying without health care in the richest country in the world.
Congresswoman, there is a difference between universal health care and Medicare for all, single-payer health care. So I guess I'm wondering, why is this the road you're going down? Because if we're going to have a Scandinavian-style social safety net, or if, for that matter, a Canadian-style one, that requires a Scandinavian-style tax burden, which we do not have here, which there is no appetite for here. Democrats can't even get on board with allowing Trump's tax cuts from 2017 to lapse. I mean, doing something like this, as opposed to many of the other models that exist out there to ensure universal health care, which, as you point out, every other industrialized country has, this is much more expensive and requires much higher taxes.
Well, actually, that's not true. The Congressional Budget Office has come back and done a study of what Medicare for all would cost. And what they've said is it would actually cost significantly less in total expenditures, because you have to remember what people are doing now is they're paying through their copays, through their private insurance premiums. We've even had a lot of businesses come on board, and even labor unions that have negotiated healthcare as part of their bargaining efforts are saying, you know what, we need this other system because it costs so much. And the private insurance companies have generated about $371 billion of profits just in the last decade. So
yeah, but
I think
the
that
CBO, the CBO report, I read the CBO report. It says it would increase the annual costs to the government for Medicare, through health expenditures, rather, by $4 trillion. Something has to pay for that. Well, even if you seized all of the wealth of all of the billionaires in America one time, that would pay for it for about 1 year.
Well, but the thing is that people are already paying for it. So if they pay it into a tax that goes just like Medicare is, right, you can actually reduce the overall amount of spending, and you can provide comprehensive universal health care. You know, it used to be that the private insurance companies would say, oh, Medicare for All doesn't offer choice, which was a lie, because it doesn't actually change the system of providers. All it does is provide a government insurance card. But now what you're finding is, even with these private insurance companies that are trying to privatize Medicare, what they're doing is their doctors are telling you whether or not your doctor is correct in prescribing what they're prescribing for you. And they're taking away choice by saying you can't go to certain doctors, you can't go to certain networks. This person is out of network. And they're raising the costs on your private insurance premiums, your copays, and your deductibles. So, yes, of course, it's going to cost money. It will cost money, but it's going to cost a lot less for the average American, and actually overall in terms of expenditures. It's just that the money is not going to go into the profits of big private insurance companies. That's where the waste gets cut out with a Medicare for All system.
Congresswoman, before you go, quickly, I've been talking to a lot of Democratic voters who, on immigration and a whole number of other issues right now, are confused about their party's messaging. You know, to go back to immigration, to hear that some members of the party are going to El Salvador trying to raise support, while others are saying this is not our issue, Trump wins on this, we'll be quiet on it. What's your message to people who are worried the Democrats still do not have their stuff together for this fight?
Well, I think that the core message is that Democrats are going to fight for working class and poor people across this country. And we're going to fight to give you the things you need to have a decent life, right? Affordable housing, a roof over your head, food on the table, education for your kids, retirement with dignity, healthcare, childcare. Those are the critical things that people need to thrive. I think at the same time, you can have a very populist working class agenda that takes on the billionaires and the biggest corporations that are screwing a lot of Americans across this country right now. They're getting richer. Everybody else is getting poorer. But you can still have an inclusive tent that doesn't throw immigrants under the bus, that doesn't throw trans communities under the bus. Those are not two competing things. And I think most Democrats, and you're seeing this, most Democrats recognize that we have to stand up for our values. At the end of the day, we can't stick a finger up in the air and figure out where we think the polling is going to be and try to be a Republican light party. We actually have to be a Democratic party. We have to stand up for Democratic values, and we have to stand for things, not just against things. I say we got to be a proposition party, not just an opposition party. And then we got to fight for it, because a lot of people see us in bed with billionaires taking money on the campaign side, and at the same time trying to say that we're going to fight for regular working people. And I think we got to recognize that people can smell a rat, and they got to trust us to really make sure we deliver on the things we're promising.
Voters can definitely smell a rat. We're hearing the exact same thing. Congresswoman Pramila Jayapal, thank you so much for joining us tonight.